everyone. I'm Barbara Hamlee. This week we learned that 5 members of Vice President Mike Pence's inner circle have contracted COVID-19. Meanwhile, President Trump continues to downplay the severity of the coronavirus pandemic, even predicting that no one will be talking about coronavirus after the election. But when you talk with people who have survived COVID-19, you get a very different perspective. Up next on Another View, the cautionary tale of one woman's fight to survive and to live. Her story will make you think again about the seriousness of this disease. Stay tuned. Another View will be right back after this news from NPR.
Discussing today's topics from an African-American perspective, this is Another View.
Good afternoon, everyone, and welcome to Another View. I'm Barbara Hamlee. We've got 5 days before we go to vote. And the Norfolk NAACP, the Elnora branch, is doing Souls to the Polls. Now, this is in partnership with New Calvary Baptist Church, Shiloh Baptist Church, the National Association of University Women, and Blue Wave, and they are offering free rides to the polls. Now, it's primarily for Norfolk residents, but if you live outside of Norfolk and you don't know where to go, they are willing to help you find out how you can get assistance to make sure that you can get to the polls. So please do not let transportation be an issue. If you'd like to reserve a ride, please call the NAACP at 757-805-8978. That's 757-805-8978. Souls to the polls. We're doing everything we can to help you to exercise your constitutional rights. So please make sure that you go and vote next Tuesday. And, you know, it's at the top of political discourse, the coronavirus pandemic, with President Trump insisting we're turning the curve and challenger Joe Biden promising to get the pandemic under control. Our guest today will tell you that politics has nothing to do with it. For our guest, it was literally a life and death situation. Please welcome nurse Janice Langley, who is a COVID-19 survivor. Hi, Janice. How you doing?
Good afternoon. It's good to be a part of this program.
Thank you so much for joining us. We really appreciate it. And welcoming back to Another View is internist Dr. Alvin Harris, who has been diagnosing and treating COVID patients since the pandemic began. Dr. Harris, how you doing?
Doing great, Bob.
Good.
Doing well now since the first wave has gone past us.
So you're doing better now than the first wave?
Oh, much better.
Oh, okay. All right. Well, I want to start with Janice because I'm really curious to hear your story, Janice. But before we start talking about what happened to you in terms of your exposure and contracting COVID-19, kind of set the stage for us. What was your attitude about coronavirus prior to becoming infected?
Wow. Well, you know, we, as a healthcare provider, we take precautions on a daily basis. And this virus was just so unique and in a category all of its own that we were all very uncertain, didn't have a lot of knowledge, of course, about, you know, the spread or how it could be treated. So the attitude was, what are we going to do? What are we going to do as healthcare providers to protect ourselves and our patients and everybody in general? So there was some anxiety in the beginning. And then, of course, as the numbers increase with positive results and with death, healthcare providers then became certainly extremely alarmed because we were on the front line of potentially being exposed to the virus, and there being no treatment for it. It really was a frightening experience. And of course, we could not say, well, I'm just going to stay home, because as healthcare providers, you know, we're out there no matter what. We're trying to provide care for those who can't care for themselves.
So do you think that's how you contracted the virus? because of your work as a nurse?
I don't know. I can't really say that someone who was a carrier, who was asymptomatic, who potentially coughed on me or sneezed on me or, communicated with me as a nurse. I could have been exposed from, someone I passed in the grocery store or, waiting in line at the pharmacy, or I just have no idea about where, because you can't always pinpoint where you were exposed.
Right.
The fact that I was a nurse at the time that I contracted it certainly increases the risk of being exposed.
So tell us what happened. You were tested, and you got your test results back. And what did they say? And then what happened after that?
Okay. So because we were having so many people at my employment site being identified as positive cases at that time, then, of course, as a healthcare worker working in a medical department, we had the option of being tested. And I was tested on a Monday, and results came back to me on that Wednesday, and the provider said, you've tested positive for COVID-19. And of course, I couldn't remain at the workplace. I had to go home to quarantine for the 14 days. Within that time frame of leaving on a Wednesday afternoon, between Wednesday afternoon and the wee hours of Friday morning, I became critically ill with the virus.
Well, so when you found out that you had tested positive, were you afraid?
No, I wasn't, because I didn't have any symptoms. I had, no fever at that time. I felt fine. I went about my daily activities until that Wednesday I got the results. And of course, even on that Wednesday, I had no symptoms of COVID-19.
So pretty quickly, you became ill. Can you describe to us what happened to you?
Yes. I came home like I said, on that Wednesday. And that Thursday morning, I felt a little warm. And I thought, well, let me just take my temperature. And of course, at that time, it was like 99.5. And I thought, that's unusual for me, because someone who normally has a body temperature of 97, to me, that was a little bit concerning. So as the evening went on, I continuously checked my temperature. And of course, at one point, my temperature was extremely high. It was over 101.5. And I started to feel really bad. One thing I noticed was I could not smell, and I had no taste. So having the knowledge that these were some of the symptoms that accompanied the COVID-19 diagnosis, I thought, well, I need to go somewhere. I started to feel really bad really quickly, and I went to the emergency room. And of course, when I told them I had tested positive and they checked my temperature, and my temperature was elevated even more, then, of course, they decided to take me back to the evaluation room to do more tests.
And you discovered at that point they did admit you, but you continued to get worse.
They admitted me, and what's interesting is my memory from the time I walked into the emergency room until the time I woke up in the ICU, I don't remember any of that activity. I've gotten the information from my provider, who is a pulmonologist and cared for me while I was in the hospital. I don't remember much. I remember them saying, we're going to keep you. So I was admitted to a regular floor at the time, a medical surgical floor, and somewhere between the time I was admitted and a day later, my respiratory effort was at zero, pretty much.
So you could not breathe.
I could not breathe. My O2 sats were, almost 79 and 80%, which is, critical for the respiratory effort to have O2 saturations above 95. So the provider decided to admit me to the intensive care unit and to intubate me. Anesthesia came up and actually intubated me. And that simply means they actually inserted a tube so that I could get oxygen down into my lungs because I could not breathe on my own, basically.
And you had to be intubated twice.
I had to be intubated twice. They attempted to take me off the ventilator the first time, and my respiratory effort was so bad that they had to re-intubate me. The anesthesiologist was actually hesitant to do that, and I'm so thankful that my provider said, no, I want her re-intubated. I want this to happen again. And so I was intubated twice.
So how long were you in the hospital?
I was in the hospital a little over 21 days in the acute care hospital, and then I was transferred to an acute care rehab center. So one of the things that happened, I had what was called critical illness myopathy. In other words, my muscles wouldn't work. So not only did I have respiratory issues and had to be on the oxygen, but I had to learn to walk again because my muscles would not sustain me. I couldn't sit up. I couldn't turn over. I couldn't stand. So I had to be rehabilitated for all of those physical things. And I had to be taught how to swallow because there was damage to my right vocal cord. They did not think I was going to be able to have my voice completely back. And they were afraid if I had foods or liquids that potentially I would aspirate fluid because of not being able to swallow properly. So there were a lot of things that I had to learn to do over again. And simple things that we take for granted, like brushing your teeth or taking a shower. I couldn't do any of those things without somebody doing those things for me.
Because your muscles just would not work again because of when you were intubated, you were laid out in the bed. I mean, you were not moving and you weren't awake, were you? Were you in a coma?
I was not awake. I was unconscious pretty much because of the ventilator. If you're awake, of course, then you're going to fight that tube. You've got something down in your throat that is foreign, and you would attempt to get that out. So, of course, with soft restraints and things that would prevent me from trying to attempt to pull that tube out. But I was not aware of anything. I was comatose.
Wow. Janice, I know in reading your story, you said that you felt that because you were in a smaller hospital, that it saved your life. Why?
I will stick to that until the day I'm no longer here. Had I not been in a community hospital in my neighborhood, I don't think I would have survived because, the numbers are smaller. Some of the staff know you. The providers know you. Not that I got any special treatment. It was just that they could focus on me because I was not a statistic. I was not just a number. I do believe when they tried to wean me from the ventilator the first time, had I been in a larger facility, they would not have I don't think, reintubated me and given me another chance.
Mm-hmm.
And that the fact that the anesthesiologist was resistant to do that intubation a second time, I could see that happening at a large hospital.
Mm. Now you live on the Eastern Shore, and
I live on the Eastern Shore. Mm-hmm.
and I know that there has been in the past outbreaks on the Eastern Shore. There was a lot of concern, especially at the beginning of the pandemic. I don't know if it's gotten any better. Has it, in terms of the infection rate?
It has gotten better. I do know I saw my doctor on Friday, and he did say that the hospitalizations have gone down
Mm-hmm.
for the area. There are employers that are following the CDC guidelines with, temperature checks and having hand sanitizing stations and providing masks for people who may not have them and social distancing and all of those things. These employers are doing these things to protect the employees as best that they can while they're at work. When they go home, that's a different story. They can't follow them home and have them do those same things. But I think our numbers are going down or not increasing on the shore, as in some areas, because I think the employers in the area are taking it seriously, and they are trying the best that they can to prevent the spread. And so I do feel like a lot of what's happening on the shore is because we have people who are paying attention. We have a governor who is from the shore, and his concept about all of Virginia is we need to wear masks. He was one of those people that said we needed to do that when all the others were fighting against having to wear masks.
So I asked you just before we went on the air, if you were back at work, and you told me that you may not be going back to work. What's the residual effect of being post-COVID? I mean, you're not suffering with the disease right now, but it did leave a lasting medical issue.
Yeah, right now I'm still having extreme fatigue. I still have shortness of breath with activity. If I'm sitting still, I'm pretty comfortable. Mm-hmm. I still have to have some blood work and a CT scan of my lungs because there's still something there, some scarring or something that the doctor is not quite sure what's left. Mm. They also thought at one point I had some cardiac issues, so they're monitoring that as well.
Mm-hmm. Did you have any pre-existing conditions before you became infected? I know that they talk of in the beginning.
No respiratory issues, no physical issues, none of that. So, why did it hit me so hard? I don't know. The providers don't know. Some people just are more susceptible to things than others. I was relatively a healthy person. The blessing, I think, with this COVID infection is my kidneys continued to work. And that's one of the things that causes death with some people is that the kidneys are no longer able to function and rid the body of the toxins that occur on a daily basis. And the other thing, I did have bacteria in my blood. I had some septicemia, which is bacteria in the blood, and I had some fungus growing in my throat because of the tubes. So there were several things that they had to treat as well as treating COVID.
Dr. Harris, let me bring you into the conversation. You listened to Janice's story. Has that been repeated for you in terms of diagnoses that you've been involved in since this pandemic began? Is her story unique or is her story typical?
Mrs. Langley's story is very typical. What is really interesting is this is primarily a virus that causes respiratory diseases. And unfortunately, viruses are much like the lady describes in Electric Slide. You can't see it, you can't feel it, you can't touch it. But if you get it, you know it's there, okay? And so in that sense, many people will tell you in the beginning that they have problems with smell and taste. But then there are others, based upon their existing conditions. Do you have diabetes? Are you hypertensive? Are you elderly? Do you have arthritis? Do you have any debilitating diseases? In those people, the virus has a field day. Because if you are with a pre-existing condition, oftentimes your immune system is also altered. And we must remember that it's our immune system that is our line of defense against disease. So the story that she tells is excellent. It is typical. It is the variation that comes in is where you are as an individual. The most important thing that I want to bring up, too, is the fact that because this virus, much like the song that is electric, there are those out there who believe that it's a hoax. And part of that belief comes from the fact that some people declared it a hoax before it became popular and with its own notoriety. There are a lot of people that don't believe that this virus exists. The tragedy is there are 227,000 people who can't tell their story like Mrs. Langley can tell hers. They died from the disease. And it's tragic. It is tragic. The situation about whether a small hospital can treat a patient better than a large one, not really. What you're really saying is, do competent people at a competent healthcare delivery facility treat people better than people at a facility that has never had one of these cases before, or this is the first one that has come into the door? And there are many large hospitals that routinely serve their patients very well and treat this almost routinely. They come in, they're sick like she was, and for some, they're out in 5 days. Yeah, witness the President of the United States. But then there are others who aren't as lucky. And because they aren't as lucky, they follow a downhill course.
440-2665 or 1-800-940-2240. I would really love to hear from people who still think that coronavirus is a hoax. I really want to understand what it is that keeps you from believing that this disease can affect you. When you hear a story like Janice Langley's, when you hear other people who talk about how they have been affected, whether they were affected mildly or severely, 440-2665 or 1-800-940-2240. Also give us a call. Have you contracted COVID-19? And are you a survivor? And what is the message that you would like to get out to others as we all struggle to try to get this pandemic under control? 440-2665 or 1-800-940-2240. And if you're just joining us, we're talking about the impact of COVID-19 through the personal story of our guest, survivor Janice Langley, and internist Dr. Alvin Harris, who has been treating COVID-19 patients since the pandemic began. So I want to understand, or I want both of you to tell me how you react when you see things like the gentleman let me get his name. Justin Turner yesterday, the baseball player who took his mask off right after he had been diagnosed with COVID-19 and participated in the celebration as the Dodgers won the World Series. Or when you hear the president say, "We've turned in the corner. It's not a big deal. Don't let it take over your life." When you hear people deny it, Janice, what does that do for you mentally? And what do you want to say to those folks?
You know, Barbara, it's frustrating to know that we have the numbers to prove that this is a real thing. It's not science fiction. It's not something that somebody's trying to play a game. It's real. We have people who have suffered through this virus, and fortunately, I'm one of them who is available to talk to anyone who has a question, who wants to talk to somebody who has experienced what I've experienced. I'd be willing to do that. It is totally real. It is not a game. It is not something that I would wish on anyone. And the reality of wearing the mask has proven to be beneficial. So we already know several things. That is how the virus is spread and gets into your body and what systems it affects and what we need to do as far as staying away. We know how far, mucus and particles and droplets can spread just from sneezing and coughing and talking. So why would you not put a barrier there that could help us not contract the virus? Mm-hmm. So there is frustration with people who don't want to protect others. Protect others by wearing a mask.
Dr. Harris?
Far away.
Mm-hmm. And Dr. Harris, your reaction when you hear people say it's not a big deal?
One thing we must all remember, one thing my mother used to always tell me, she said, "Son, it takes all kind of people to make a world." We have a world where there are people who have rights, and one of their rights is that if they don't care to, they don't wear a mask. Now, there are consequences to that, but the point is that human behavior is so variable that it's extremely difficult to make us all see and think the same way. Now, we try to get people to do what is in their best interest, but we must remember that there's a great variation in how people see the world. And for some, they don't see the world the way that others do, because many of us, by experiences, have witnessed, and we are absolutely sure what we see. Mm-hmm. It is very, very difficult because some even get angry, okay? But leadership is extremely important. If at the national level we had a leader who preached the importance of mask wearing, the way that our governor, a physician, every time you see him, he has a mask on. And even he and his family contracted the virus. The point is that there's great variation, but within that variation, we must also add some other elements with belief, and that is prayer. We must pray for those. We must try to win them over, but we must also remember that the reason we wear a mask is not so much for ourselves as it is for them, because they, in not protecting themselves, will come down. They are the ones who will fill up the intensive care units at your local hospital. They are the ones that will fill up the beds at your local hospital. And as you see out in Wisconsin and in other places, those who come down oftentimes may have no place to turn if the hospital is already filled.
440-2665 or 1-800-940-2240. Elena joins us from Norfolk. Hi, Elena. You're on the air.
Oh, thank you very much. This is so important. I love your show, love you, and
Thank
I'm
you.
delighted that you're doing this. It will save lives. I did not get on the show from the very beginning, so the doctor may have already addressed this, but I don't know if it would be a problem to repeat it.
Mm-hmm.
One of what I'd like to hear is more about the features, because there seems to be many perverse features about this virus that humanity has never encountered before. One, we knew about the droplets, but now there is talk of the virus being aerosolized and traveling beyond the 6 feet that we knew about with the droplets, and traveling 25 feet or more, being aerosolized. And the best description I heard was from Dr. Sanjay Gupta, who said, think of it as we would smoke. But the perverse part of it is that with smoke you could smell it and see it. The air would be a little clouded. With this, the aerosolizing of the virus, it is not visible and it's not perceptible. So we must use the face coverings, the mask, everything we can to avoid that.
Okay, Elena, let me let Dr. Harris answer your question, because I don't want to run out of time and I want to get you some answers. Thanks so much for the call, and we appreciate you listening to the show. Dr. Harris, you want to talk about again what the characteristics of this virus are?
Viruses, unlike bacteria, are not really living organisms, but they are so lightweight that a person can cough, and there is no telling how far that virus will be spread into the environment. And someone can be walking through the mall unmasked, breathe into their lungs that virus, and all havoc break loose. One of the things that's extremely important is the perception of when you become ill. Mrs. Langley was doing well until she noticed her temperature changes and that she began to have problems with taste and smell. She noticed that she was not her normal self. This virus can cause all kinds of presentations that ordinarily you look at your friend and say, is she faking? Is something wrong with her? Is this psychological and mental, or is this real? There are those who have had syncopal episodes as the major manifestations. This virus can attack just about any organ system in the body. The brain, she talked to you about her muscles, how weakening of her muscles, how she had problems walking. The neurological systems, the tingling, the nerve situation, in which she had problems with smell and taste. But the major focus that is the most frightening is the respiratory, because there can be decompensations in your ability to breathe. And it reminds me so much of Black Lives Matter. I can't breathe. A patient, especially those who have asthma, chronic lung disease, can deteriorate in a matter of minutes. They can go from being alive and well, alert and oriented, to agonal breathing, almost death, require needing to be intubated and ventilated by machines. This virus is the real thing, and I don't want to be someone who's out trying to use scare tactics, but this virus must be respected. And if we do not wear a mask, if we do not wash our hands, if we do not maintain proper distancing with people we don't know and people that we do know, as you notice, wherever there have been large crowds, there have been outbreaks, partly because there are those who aren't, in quotation marks, sick, but they are carriers of this virus. And they can cough into the air, and a person can pick that up And one of the things that really bothered me is Herman Cain, who was prominently at the meeting in Oklahoma, and 9 days later checked into the hospital and subsequently died. And just picture 220,000 Herman Cainses. Anytime you lose a loved one, a family member, a neighbor, it pains us all. And the thing that we must be able to do is respect others by way of respecting ourselves. Wear a mask, not so much to prevent us from getting the disease as it is to prevent us from transmitting it to those that we care about.
Okay. Let's go to Richard in Newport News. Hi, Richard. You're on the air.
Good afternoon, Barbara.
Hi.
Hi. My mom was quarantined with tuberculosis in the 40s, sanatorium. And so I do understand the severity of it. My complaint or my wish, 300,000 people roughly die of obesity every year. We don't talk about these things. Personal responsibility. Absolutely, everybody should wear a mask, but we need to take the politics out of it.
Okay.
Hopefully, I don't think we hear both sides of a topic. Personal responsibility is huge, whether it's the mask, obesity, these things all play a role.
Okay, Richard, thanks so much for the call. We appreciate it. Janice, the point being, in terms of, as we were saying, if everyone would take responsibility for themselves by wearing a mask so that they can protect others, then all of us would be protected. Is that right?
That's my concept of, whether all of us would be protected, I can't say. Because you still have to be able to know the proper way to even wear the mask. I see people who are wearing a mask and they're wearing it only on their mouths. They haven't covered their nose. So you still have a lack of knowledge about what we're supposed to do. And people who are using the hand sanitizer and then wiping their hands with a paper towel, that's not how it is effective. Or if you can stay more than 6 feet away, then stay more than 6 feet away. So will it protect everyone by wearing a mask? It may not protect everyone, but it darn sure will protect the majority.
Okay.
And the gentleman that talked about accountability, here's accountability. Wear the mask. We talk about, personal rights and personal accountability. This is something that we're talking about because it is so prevalent, it's so rapid. There's no history of it. With all of the other things, we do talk about obesity and we do talk about other health conditions. So whether you're in tune to the information that we're providing because potentially you're not an obese person or you don't have someone in your family, so you're not paying attention to this. This is global, and it is massive, and we're trying to shine a light on what can happen and how we can prevent this globalization from occurring by doing a couple of simple things that are not taxing to anyone.
Okay, I'm going to try to get as many calls in as we can because our phone lines are lit up. 440-2665 or 1-800-940-2240. Richard joins us from Chesapeake. Hi, Richard. You're on the air.
Hey, Barbara. Let me just say I listen to your show when I can, and I really enjoy your show.
Thank you very much.
My question to the doctor is when they do drug tests and things like that, they have a placebo effect. Miss Langley, when you were notified that you were a positive for COVID, were you feeling any symptoms? And did them notifying you possibly have an effect of bringing on symptoms? Not you were already affected, but could that stress of knowing cause it to get more serious than it was, because there's multiple strains out there? And just to give you my background, I was in a building with people who were 45 of them were positive. So, and like Ms. Langley said, common sense precautions do a wonderful thing. They prevent you from getting it, and they prevent you from spreading it. So what she's talking about is, realistic. So let's get back to, do you think the knowledge of you getting it and the stress from it caused it to become worse than what it was?
Okay, let's let Janice answer that. Thank you so much for the call, Richard. We appreciate it. Janice, what do you think?
I don't think that was the case. I think, when I had the test and got the results, how long had I had the virus in my system? Because we know there's an incubation period. I don't think that if I had taken the test on that particular day and gotten the results would have made a difference. I think my illness was brewing, and I just had not had any symptoms prior to that. So stress, as a healthcare worker, we're stressed with potential exposure to all types of things every day. And so we already practice universal precautions because we don't know who's a carrier of what. Mm-hmm. So that stressor was not something that I think triggered those symptoms. I do think that those symptoms were already in my body and manifest quickly after that.
Okay, let's go to David in Norfolk. Hi, David. You're on the air.
Hello, Ms. Hamley. How you doing?
I'm good.
Yeah, well, I've noticed a lot of people, particularly on social media, talking about it's a hoax, this, that, the third. Well, that hoax killed my cousin.
Killed your cousin, you said?
Yep.
I'm sorry.
Thank you.
We're sorry.
And I know some other people who had it. A good friend of mine is okay now, but she says she'll be fine for about 3 weeks, and then she'll start getting a fever and spiking this, that, third. I mean, I don't know. You believe what you want to believe, but don't drag the rest of us down with you. Wear your damn mask.
Thanks so much for that call, David. We appreciate it. Dr. Harris, people talk about the residual effect. I mean, once you get through the virus, if you will, it still leaves lingering after effects, doesn't it? Dr. Harris? Uh-oh, I think we may have lost Dr. Harris. Well, Janice, let me go to you. You're a healthcare professional also. I mean, Dr. Harris, are you there? Janice then answered the question in terms of for David. He talked about a cousin having it and then, getting fever again and that kind of thing. There are residual effects.
There are residual effects. And if the cousin is getting fevers again, I would definitely have that person seek some medical attention to make sure that there's not something else brewing again, because there's nothing to prove that we cannot be reinfected with this virus. And that's what's scary. If you've lived through it and then eventually you can potentially get it again, that's most frightening. But the residual effects that I am currently suffering with, of course, the severe fatigue, the fact that there are things that I cannot do without becoming short of breath because the demand for the oxygen in my body at that particular time is more, the demand is more than what I have to supply. So those kinds of things. I don't know if my memory has been affected greatly, but there are things that I have to stop and think, why did I come into this room, or what is it that I was supposed to get? So is that part of some residual effects? We don't know. We did hear Dr. Harris talk about, any part of the body or any system in the body can be affected.
Mm-hmm. Mm-hmm. Janice, we only have a couple minutes left. I want to ask you about the holidays because, all of us universally love to get together for the holidays, but particularly in the African-American community, that's huge. Thanksgiving, Christmas, the big dinners, the whole nine. What would you say to people for 2020's holiday season?
Well, that is so hard because we have become so accustomed to doing that and the traditions. I would say it's difficult to not do that, but until we see where we're going, do a Zoom party, do a conference call, and be thankful that your family is still around in the 2020 holiday season to even speak to each other. Be thankful that they have food, that they are healthy, that you can hear their voices, because COVID has taken away a lot of voices. And so the gatherings, I think we should try to surpass them this year until we actually see what's going to happen in the months to come.
Yeah. So for you, you're going to continue to heal, and hopefully things will work out, and then you get to retire. Is that right?
That's it. That's the plan. That's the plan. I do thank you for having me on the show, and to shed some insight as to how it affected me personally and how it can affect anyone.
And Janice, we thank you so much for sharing your story. That's Janice Langley. She is a nurse on the Eastern Shore, and she is a COVID-19 survivor. And unfortunately, we lost Dr. Alvin Harris, who is an internist in the western part of Tidewater and a regular on Another View. But he also brought us some insightful information. Thank you both so much, and we'll be right back.
I'm with Marcellus, and you all are checking out Another View. Don't go anywhere. Check us out.
And welcome back. COVID-19 has changed our lives in many ways, including how we experience sports. So far this year, we've witnessed everything from quarantined players to empty arenas to rescheduled games. Our Lisa Godley recently sat down with a sports reporter from the Boston Globe who graciously shared a little of what he witnesses each and every day. Gary Washburn gives us an inside look at the impact the pandemic is having on sports, the athletes, and the fans who cheer them on.
Imagine going from hearing this when you play to this. Boston Globe sports reporter Gary Washburn doesn't have to imagine, because for 90 days, Gary, along with a group of reporters and the rest of the NBA, were in the bubble at the Walt Disney compound. Gary says having the players perform in the bubble changed the fabric of the game, at least a little bit. But then they got used to it.
Well, it took a lot to get used to for the players to not have crowds. I mean, they've been playing in front of crowds for obviously their whole life. It was a different experience for everybody to hear the shoes squeak and hear the silence when teams scored, because there was no real fans in there, so no one really cheered besides the teams themselves on the bench cheered when players scored baskets or made a positive play for their team. So that took a while to get used to. And then the NBA decided to pipe in crowd noise to kind of take away the silence and the awkwardness of it, which I thought was a good idea. Although it was artificial, it just gave more of a feel of an arena than it was before.
So what was life like in the bubble? Were there some people that could come and go, or was everybody just on lockdown during that time period?
No, I mean, there were two different tiers. Tier one was we were on campus every day, tested every day, breakfast, lunch, and dinner that we were fed, just that structure, that kind of college structure. And that was what I was in.
I gotcha.
There was a second tier of reporters who were tested twice a week, who were allowed to stay in hotels but they could not get anywhere close to the players, to the other reporters in Tier 1. They were allowed to watch games from about 100, 200 feet away. I could see them up in the stands, but I couldn't go up and shake their hand or anything, no contact, because they weren't being tested every day.
As much as things have changed, Gary doesn't feel the pandemic will cause any sports to go away permanently. This also holds true for high school and college sports. And let's not forget the fans. A
lot of sports were canceled because of the pandemic. I mean, and you're talking about kids who could not finish their careers, who had to, sacrifice their college eligibility because there were no games. Mm-hmm. The NCAA does not want that to happen again, so they're going to figure out a way to play. If you're looking at the college game, the Deep South obviously just had no intention of canceling a season. That was not going to happen. They were going to play football because that's a cultural norm there, way of life. So they were going to figure out how to play. Even though they have cases, they were going to allow fans. Now, do I think that all fans need to be masked? Yes. Is that the case? No.
As for the Olympics, he says they've already postponed it for a year, so he doesn't believe it will be canceled again. But he does see a lot of precautions taking place when they do.
They're going to need to arrive in Tokyo early, test right away, maybe quarantine. I don't know if that's possible to have all these athletes quarantine a week before they begin the games, but I think that's going to have to be something that they consider, to whereas at least they start fresh and they start clean, especially from the United States. Let's face it, I mean, we're the country now that's got the most cases, and there's countries who are pointing to us and saying, hey, I don't want to play with American athletes. Now, I don't know about fans. I don't know the cases in Japan, whether you can play in front of fans. So I think they're going to be very careful, but I do think they're going to try to pull it off.
In the meantime, we'll continue to both play and watch our favorite sports differently. For Another View, I'm Lisa Godley.
Coronavirus and COVID-19 affecting us in many, many ways. So we appreciate each of you for listening to our show today. Please, I implore you, take the spread of the coronavirus seriously and do your part to keep yourself and others safe by wearing a mask, washing your hands frequently, and practicing social distancing. And if you know someone who could use some encouragement, send them to this podcast of the show that you just heard. You can find it at anotherviewradio.org. And don't forget to sign up for our eView newsletter. It's a once-a-week reminder of upcoming shows. We're on Facebook, and you can find me on Twitter at Barbara Ham Lee. Let me remind you also that the Norfolk NAACP is providing Souls to the Polls. It's an opportunity for travel to help you to vote. If you need a ride, please call 757-805-8978, 757-805-8978 to schedule your ride. We all must vote. If you haven't already voted, be sure to vote on November 3rd. Next week on Another View, Dr. Eric Claville, with analysis of the outcome of the presidential elections, along with the relationship expert Alvin Harris, who shares some self-care advice to help us all get through these very tense times. Our theme music was composed and performed by Jay Sennett. Lisa Godley is our show producer. Todd Washburn is our audio engineer, and Dr. Barry Graham answered our phones. Next Tuesday is Election Day. If you haven't done so already, please go vote. It matters. Stay safe, everyone, and join us again next Thursday at noon for Another View.